Okay, can everybody see my slides?
Mm-hmm. We can see it.
That's great. Okay, so sexual health as a core part of overall well-being and quality of life. The World Health Organization define it not just in physical term, but as a state of physical, emotional, mental, and social well-being in relation to sexuality. When sexual dysfunction occurs, the impact can be profound. It can strain relationship, reduce intimacy, and contribute to anxiety, depression, and low self-esteem. Uh, Take erectile dysfunction as an example. It doesn't just affect performance, it often undermines confidence and partnership satisfaction. But the consequences go well beyond the bedroom. Sexual dysfunction can affect productivity, focus, and overall work performance. And on a broader level, it influences family stability and even community health. That's why sexual wellness is not just a personal concern, but truly a public health priority. So, as you know, sexual dysfunction in men is very common now. In a 10-year study of over 2,000 patients, the top reason for visiting were erectile dysfunction at around 41%, apparent disease at 18, premature ejaculation at 16, and low sexual desire at 10% among the men. In the US alone, more than 30 million men are affected by erectile dysfunction. Prevalence rises with age, about 40% of the men at 40, nearly 70% by age 70, and over half of the men between 40 and 70 report at least mild to moderate ED, which means erectile dysfunction. Overall, erectile dysfunction and premature ejaculation are the most common male sexual health problem today. If we consider the erectile dysfunction as the most common male sexual problem, which we are going to talk more about this tonight with Dr. Asandra, and also Dr. Trong would help us. Its causes are often multifactorial. It can be psychogenic, such as age-related libido decline or performance anxiety. Most cases are vasculogenic, arteriogenic causes like diabetes, hypertension, obesity, smoking, and aging impaired nitric oxide signaling and blood flow, while cavernosal or venous leak prevents maintaining rigidly despite normal inflow. Another factor could be neurogenic factor, including stroke, Parkinson, spinal cord injury, or surgical and diabetic, again, a kind of diabetic nerve damage, account for up to 20% of the cases. Hormonal issues such as low testosterone, thyroid, or adrenal disorders, and again, diabetes further reduce vascular and neural function, and we can end up to uh, erectile dysfunction problem. Other contributors include certain medications, trauma to the pelvis or perineum, and anatomical problem like Prurian disease gonna be another risk factors for erectile dysfunction. In short, ED arises from overlapping vascular, neurogenic, hormonal, and structural pathway, and often serves as an early warning signal of broader cardiovascular disease. Early cardiovascular disease could be one of the signs for that as ED, or it has a kind of vice versa. If we see the cardiovascular disease, most of the case we can see the ED and vice versa. So, another common problem, and I talked earlier, it was the premature ejaculation, and its causes are often mixed. Psychological factors like performance anxiety, depression, and relationship stress are very common. It's also strongly linked with erectile dysfunction, and the two often make each other worse. Hormonal issues such as hyperthyroidism or low prolactin can contribute, while the urological side, uh, conditions like chronic prostatitis, pelvic pain, or even varicocele are frequently seen. A structural factor, including changes in pelvic floor muscle, can also play a role, which brings us to the next important area of discussion. And one of the things I really want to bring in this society as a new idea for the study, it's just started for a couple of the in a couple of the clinics, but still we don't have that much data about that, which is going to be the pelvic floor muscle and application of the PRP for men in pelvic floor muscle, specifically for premature ejaculation, and also it could be for erectile dysfunction. As I just mentioned, pelvic floor muscle play a critical role not only in urinary control, but also in erection quality and ejaculatory control. Weakness, imbalance, or inflammation in this muscle can worsen conditions like stress urinary incontinence, erectile dysfunction, and rapid ejaculation. Now, here's the interesting idea. We know that PRP injections into the pelvic floor muscle has already shown a strong evidence for stress urinary incontinence treatment, helping regenerate tissue and improve muscle support. So, could the same principle be applied to premature ejaculation? By restoring the pelvic floor strength, improving local vascularity, and reducing the inflammation. So PRP may offer a novel regenerative approach to enhance ejaculatory control by this approach. I don't know, we would be discussing more about this with our guest speakers. So uh, we also have, after looking at male sexual dysfunction, it's important to remember that these issues are just as common and often even more prevalent in women. Globally, about 40 to 45% of the women experience some form of the sexual dysfunction in their lifetime. US survey found 43% of the women compared to 31% of the men reported problems like low desire, arousal difficulties, or orgasm issues. The most frequent concern are low arousal, low sexual desire, difficulty reaching orgasm, and insufficient lubrication, each affecting roughly 1 in 5 women in midlife. Pain conditions such as dyspareunia and vaginismus are less common but can be deeply disruptive. These challenges shift across the lifespan, rising after menopause, but also present in younger women due to the stress and relational factor. So, and as we mentioned, lack of the sexual desire and arousal is very common. Desire starts usually in the mind, but for satisfying function, the body must respond with the blood flow, engorgement, lubrication, and sensitivity. When blood flow or nerve function is impaired, specifically in sexual organ, mental desire doesn't translate into the arousal or orgasm. That's why PRP or other biologic, regenerative biologic is being explored by improving vascularity, mostly lubrication and nerve sensitivity. PRP help the body match mental desire with physical response. In practice, injections Usually for women, for this specific purpose, could be at clitoris and anterior vaginal wall to deliver growth factors where they can restore blood flow circulation and enhance nerve repair. That mechanism directly tied to arousal and orgasm. Apart from the issue of the desire and arousal, which are mostly linked to the proper function of the erogenous zone, women can also experience impaired orgasm and pain due to the urological and structural disorders. These are areas where regenerative medicine, specifically in this case PRP, may offer real benefit. So as you see here, the causes are broad condition like vulvodynia, endometriosis, chronic pelvic pain can alter sensation and create discomfort. Vaginal atrophy and inadequate lubrication, especially after menopause, are also very common contributors. Structural changes following childbirth or surgery, as well as urological disorders and even psychological stress, further complicate the picture. So, but even when the pelvic organ appear normal, some women still experience dyspnea or vaginismus, highlighting the complex interplay of the nerve, tissue, and pain pathway. By promoting angiogenesis, nerve repair, and tissue regeneration, PRP holds promise and addressing several of these underlying mechanisms, improving both orgasmic function and reducing the pain. So just as an example, one of the major contributors in impaired orgasm or painful intercourse is vaginal atrophy, also known as genitourinary syndrome of menopause. It affects nearly 45 to 47% of the postmenopausal women, significantly impacting quality of life. It's driven by estrogen deficiency from the menopause or anti-estrogen therapy, leading to thinning of the vaginal lining, loss of collagen and elasticity, reduced blood flow and lubrication, and increased the fragility and pain during the intercourse. But how PRP in this case could help? The growth factors like VEGF, PDGF, in the PRP stimulate new blood vessel formation, improving vascularity and lubrication. FGF and TGF beta drive collagen remodeling, restoring the elasticity and reducing tissue fragility. EGF and IGF promote endothelial regeneration, thickening the mucosa for better protection. PRP also support nerve regeneration, improving sensation and responsiveness. Finally, its anti-inflammatory effects help restore a healthier vaginal environment. Traditionally, local immunotherapy has been the mainstay treatment, but now non-hormonal biologic like PRP and newer intervaginal energy device like shockwave are showing very promising outcome. So when we look at the pathophysiology of the most of the sexual dysfunction conditions, we see that the key underlying issues are poor blood flow, nerve damage, tissue fragility, and chronic inflammation. And based on all of the growth factors, cytokines, and equipments, I would say in the PRP, we could overcome most of these problems using the PRP. The only thing we need to consider is the right formulation, and Dr. Trong and Dr. Asandra are gonna talk more about these factors. And in my last slide, I read one of the most fascinating paper I've ever read in this field, and I wanted to share this paper with you. This study it's a kind of fascinating piece of the evidence on how PRP work beyond just blood flow. aging leads to axonal atrophy, cavernous nerve degeneration, and reduced expression of the neurofilament heavy chain, which together impairs nerve uh, conduction and weaken erectile signaling. It also contributes to a smooth muscle cell damage and prostate hyperplasia, both worsening the erectile dysfunction. This study, although it's in the kind of preclinical study, but it's very enriched. And because of the limitation of the time, I cannot go deeper about the details of this study, but just a 20-second summary. Mechanistically, the benefit comes from the PRP-rich growth factor based on this study. IGF-1 provides neuroprotection, helping preserve axons. PDGF supports Schwann cells proliferation and myelination repairs, and also TGF-beta stimulates nerve growth factors production and promotes axonal regeneration. This is one of the uh, most fascinating study, and I highly recommend all of our audience reach out and check this study. It's open access. So sorry if it took longer. I'm gonna pass the screen to Dr. Trong, and we are gonna learn a lot tonight.
Okay. That was a fabulous presentation. I don't know if I can even meet up to that expectation, but I've learned something, and I took a picture of that last slide. That is awesome. I'd like to share my screen if that is okay.
So yes, yeah, you can now.
Yeah, I think you have to stop sharing so I can
Okay,
share.
so yeah,
All right.
that's great.
Wonderful. So that was a good preface to my presentation. And if there is anything that I'm presenting that is duplicate, I'll move through it fast because we want to save time for questions. And I'm sure there'll be lots of questions. But what I want to stress, let me put this on presentation mode before I share. What I want to stress for the attendees today is that by attending this meeting, you are going to be at the forefront of regenerative health. What are you seeing right now? Are you seeing like a multiple, or are you seeing my one slide?